Hello everyone. As you all know, my name is Kankana and I'm pleased to welcome you all to today's career guidance session with Jyoti Learning. Thank you to everyone who is able to join today, and I'm privileged to welcome our four guests today, Dr. Rose, Dr. Shalini, Dr. Nafisa, and Dr. Nargis. Today they will be talking about their journeys to dentistry and inspire our young minds and give us some insight on what some of us may want to go on and pursue in the future. First, I'll pass on to Angeline for a brief introduction to Dr. Rose.
Hi, my name is Angeline, and today I'm going to talk about Dr. Rose Thomas. Dr. Rose Thomas works as a senior clinical teacher at the University of Central Lancashire, and she also contributes to postgraduate teaching in odontology. Currently, her role is to provide clinical supervision and surgeon supervision to postgraduate endodontic students. Let's all welcome Dr. Rose to talk about our program, Bridge to Dentistry.
Thanks, Angelina.
Thank you, Angeline. Now we'll pass on to Sneha for an introduction about Dr. Shalini.
Good morning, my name is Sneha. Today it's my pleasure to welcome Dr. Shalini Kanagasigam to this meeting. Dr. Shalini is a specialist endodontist registered with the General Dental Council UK. Dr. Shalini completed her bachelor's degree of dental surgery from University Malaya and did her Master of Clinical Dentistry in Endodontology from King's College London. She completed her training at Guy's Hospital in 2009 and now teaches undergraduate and postgraduate students at the School of Dentistry. She is also a course leader for the part-time MSc Endodontology program and full-time for the Master of Clinical Dentistry in Endodontology program. She has many interests, including oral biofilm, Alzheimer's disease, cone-computed tomography in endodontics, and endodontics rotary instruments. Thank you.
Thanks, Neha. Thank you.
Now, Amia and Amiel, if you could say a few words about Dr. Nafisa.
Dr. Nafisa Suleman qualified from the University of Leeds in 2015, where she carried out her vocational training in a dental practice in Cone, and has since worked as an associate in teeth practices. Currently, she's working towards an MSc in oral surgery at the University of Central Lancashire and hopes to pursue a qualification in sedation and a PG cert in dental implantology after completing her master's.
Nafisa is very approachable and caring towards her patients and staff. She prides herself on providing high-quality care for all her patients, including highly nervous and anxious individuals. In her spare time, Nafisa enjoys cooking and spending time with the family.
Thank you, Amia and Amil.
And finally, Anugraha to welcome Dr. Nargis.
Dr. Nargis Sonde graduated from the University of Birmingham in 2012 and completed foundation training with the Northwest Deanery. She then did her dental core training in oral and maxillofacial surgery, restorative dentistry, and oral medicine in the Southwest, where she participated in an undergraduate clinical teaching at Bristol Dental Hospital. Dr. Nargis was a general practitioner in the University of Central Lancashire as a clinical lecturer. In her current role, she teaches undergraduates all across year groups in Phantom Head and clinics, whilst also undertaking an MSc in clinical periodontology. Dr. Nargis has been involved with dental admission interviews at the University of Bristol and UCLan and undertakes research and has been published in peer-reviewed journals.
Thanks, Anu.
We'll start the webinar and pass on to Dr. Rose, Dr. Shalini, Dr. Nafisa, and Dr. Nargis. Thank you.
Thank you, Prakash, for inviting us to give you some more information for the students about dentistry and what to look out for if you want to choose dentistry. And thank you so much to Kankana, Sneha, Amir, Amil, Angelina, and Anu for the introduction for all of us as well. I met Prakash.
I'll start off with the dental schools. So there are 16 dental schools in the UK which provide dentistry as a course. Now, out of them, 14 provide predominantly undergraduate applications, whereas 2, Aberdeen and UCLan, accept postgraduate applications only. The other undergraduate universities do have the ability to accommodate postgraduate applications. However, they're much smaller cohorts or a smaller quota. So in some universities, there'll be 2, others there'll be 3, and it can vary depending on who the universities want to take. So what I normally advise people is just look at what university you're suitable for, and pick accordingly. You can see from the map that they are fairly spread out as well. So, you know, you can either stay close to home, as some people do, or you can go a little bit further away for a bit more of an adventure. It's completely up to you. But yeah, there's quite a lot to choose from. But I think when you do your applications, you have a limited number of spaces. So you just want to make sure that you maximize your choices based on what is suitable for you. Next slide. So for you guys, I think what would be most relevant at this stage would be looking at your GCSE entry requirements. So all universities want you to have a minimum of 7 GCSEs at grade 7 or 8+. You have to have English, maths, and at least 2 science subjects at a grade 6 or higher. And make sure before you apply that you do look at the GCSE entry requirements for the universities that you are interested in, because some of them do allow GCSE resits, but others don't. So you don't want to waste a slot if you've had to do a resit, if a university isn't going to look at your application on that basis. And next. A little bit further along for most of you, I know that you probably don't want to think about just yet, but maybe worth keeping in mind is your A-level entry requirement. You have to have, and these are probably the most important when it comes to universities looking at accepting you or considering your application. You have to have at least 3 A-levels, and the normal offer that people are given is you have to have 3 A's at A-level. However, there are some universities, because there's a little bit more added competition and it is quite hard to get in, they try and offer A* and 2 A's. So prepare early when it comes to doing your work, because it may be the difference between you and another applicant. 2 of your A-levels have to be biology and chemistry, and your 3rd A-level can normally be something else. However, there are certain A-levels that universities don't accept as A-levels. Within those 3, such as critical thinking and general studies. So it's fine if you want to pick them, but just note that you have to then pick another A-level for a university to consider your application. And again, some universities allow A-level resits and others don't. So just make sure that you are checking their websites before applying. Next one. If any of you guys are looking at entering as international students, the requirements are slightly different. So there are variations in terms of your international baccalaureate points that universities will accept, and they do tend to vary. So they can change this at their own discretion, depending on whether they want to take more international students that year or less international students that year. It's not a very fair system, but universities are given the power to kind of adjust those things. It's the same when it comes to postgraduate applications. They can kind of make it up as they want. I think the lowest number of points that I saw was 32 that was being accepted. However, it does clearly state that they can opt out if they want. And I think most other unis, the lowest they accept is 37. For your IB, you need at least 766 at higher level, and you have to have at least chemistry and biology at grade 6 or above. And other subjects that they encouraged to be included in that is maths, physics, or psychology. Now, the English, if you don't come from a country where English is the main language, then you do have to do an additional kind of competency test, which is IELTS. And I'm going to hand over to Rose and Shalini, because I think they both had to do it, whereas I didn't. Where you have to have at least 7 in each component in a single sitting. So they can tell you a little bit more about what's involved in IELTS. So additional entry requirements that you need to consider is you have to have some work experience in the dental practice, and it has to be evidenced on your application as well. They normally say that they want a minimum of 2 weeks, but my advice to you is if you can get a bit more, then that will only work in your favor, because you'll have a little bit more to talk about when they ask you about it at an interview, and they will ask you about it at an interview. If you can get some voluntary work done as well, that'd be great. Anything that can demonstrate that you can work as part of a team. And you will be asked at interview about manual dexterity. So something that shows that you can work with good attention to detail and you have really good fine motor skills. For all applications now, in any UK university, you have to do the UCAT as standard. So whether you're a home student or an international student, it's compulsory for everyone. And it is a paid test. Some universities will reimburse you for it, or give you a bursary for it, but others won't. So just double check. And all of these requirements have to be in place by the end of August in the year that you're applying. And it's worth bearing in mind that more competitive courses such as dentistry and medicine, the applications actually close a lot sooner than other courses. So you only have until mid-October to actually do your UCAS application in your second year of college, because all of the interviews start after that. So my core message to you guys is just start early with preparing. And what you'll find is a lot of the stuff, additional requirements that you'd need for medicine or dentistry, they also look good on any other application, depending on what subject you're applying for. So I'll move on to the next one and hand over to Nafisa, who'll talk about extracurriculars.
So thank you, Nargis. So with the application process, they also look for extracurricular activities as well. So many students can achieve the grades, but you want to stand out and show them what makes you different. So anything like hobbies that you are interested in, keep that in mind and show them as well. Don't be ashamed by it. Just keep showing them everything that you've got. So like cooking, baking, music, dancing, art, anything like that. Also, if you've entered competitions as well, boast about that, because it just shows that, you know, the drive that you've got and that you push yourself. Volunteering as well. It doesn't have to be in the field of dentistry. It can be in anything. It just shows your the other side to yourself as well, that you can get the grades, but you can help others as well. So do things which make you different to others, and also to make your application stand out. Going on to the next slide. So what if you don't get onto the course first time around? Don't worry about it. There are other alternative routes. So you've got the UCAS Clearing option, which I'll go through in more detail in a moment. Then you've also got the gap year, where you can take a year out and apply again. That's what I did. Then you've got other similar courses that you can go on to, so like dental therapy, clinical dental technology. But if dentistry is the thing that you want to do, then you might go through the other avenues. Then undergraduate, you could do an undergraduate course in something completely different, followed by a postgraduate dentistry course. So like dental hygiene and therapy, biomedical sciences as an undergrad, and then apply for the postgrad course of dentistry. Going on to the next slide. So UCAS Clearing. Clearing is how universities want to fill vacant places that they still have on the course. So you can apply early as July each year, or after A-level results day, which is about mid-August. Who can apply? So if you've basically got better results than expected, you can apply through that. Or if you got the grades, but you didn't have any offers from the universities, you can still apply through Clearing. To apply, you can go online, which I've linked some websites for you as well. And you can also do it over the phone, but you do need to register, and you need to have a clearing number that they would require. You can also contact the universities directly to see if they have got any positions available, and then they may ask you to send over your application or your personal statement as well. Next slide. So gap year. So with that, you take a year out. You take some time out for yourself, and in that time you can make your application or your personal statement even better. So like say you can travel as well. It doesn't mean that you have to be at home, just to gain experience in different things. You can volunteer. So like I said, it doesn't have to be in dentistry, but it can, if you do volunteer, it would be good to apply to gain some experience in dentistry as well. Hospital, hospice, care home, anything just to add to your skill base as well. You can work and you can earn and save some money. the university is expensive, especially if you are thinking about living out and if you don't have the support as well. Every penny counts, so you could basically save money for that, and you can also develop your skills, so like communication, team working, and all of these things you can mention in your personal statement, because that will make you stand out. So the last option would be like the postgraduate dentistry course. So you gain an undergraduate degree in anything like biomedical sciences or dental hygiene and therapy, and then you apply for dentistry as a postgraduate student. Now, there are pros to that, where you've already lived the uni experience, so you're able to balance work and social life better, but you can also work part-time and support yourself. However, you've also got to bear in mind that student finance may not or partly fund the course, so you've got to consider that, as well as the time, because you've also studied for say 3 or 4 years as an undergraduate course, and then 4 years on top for dentistry. So the time that it takes, you've got to be really committed to it. And then in the end, you might enjoy the degree that you originally started with. So you've got to think it through whether that is exactly what you want to do. And then here are the links for the alternative route to dentistry, so how clearing works, and if you want further information about it as well. Next slide, and I'll pass it on to Rose for you.
Thanks, Nafisa. So now that you heard from Nafisa and Nargis about the grades you need and how you can apply and things like that. So, but the most important decision probably in your life is deciding whether it is the right thing to do or not. So I would probably say, I mean, I had this discussion with my children as well, that you need to enjoy what you do. If you decide what you're going to do in your life, you need to make sure that you need to get job satisfaction. So otherwise you end up doing just a job. You know, as a profession, it's important to think about it. Is it really for myself? I would suggest shadowing a dentist is a good idea. So you could probably, you know, see what they do, and you can envision yourself, is this something which I want to do day to day, every day? Sometimes you would have already have experience on the other end, like as a patient, but it is important that you shadow a dentist, so you can see from a dentist point of view, or from the other side, what goes on. And can I have the next slide, please? And so once you decided, or you could even have work experience, and you could get through these before GCSEs as well, and probably having work experience as well give you an idea about what you want to do. You could have work experience not only in dentistry, you can have in different in companies or whatever. So your decision, once you make it, you should be comfortable that yes, I made the right decision. Maybe the first thing probably is to arrange through your own dentist. So keep your 6 monthly appointments with your dentist, go for your checkups, look after your teeth well, so you know they like you as well, and ask them nicely, am I okay to come and shadow you? And many of the time, I mean, we do have my own patients as well who come and shadow and see if they like what we do. And but again, and some of the things which we would like to warn you about the etiquette when you are on a placement for work experience as well. So it is important to maintain the confidentiality of patients. So, you know, whatever happens in the room with the patient and the dentist stays in the room. So you don't talk about it when you go out, and be respectful to staff and patients. And if you have any questions about the case, you talk about it to the dentist after the patient leaves. And also, once you have the work experience arranged, you need to make sure you arrive on time, and it's mainly professionalism you portray as well. Can I have the next slide, please? So just a few bits to say what we do as dentists. So we examine people's teeth, as you know, and identify any problems, do dental treatments, fillings, and fixing teeth whitening, and make teeth look nice, you know, different kinds of treatments, screen for oral cancer, you diagnose and you refer, get care for the patients, and also keep record of treatment, what we've done. So it is a very responsible job. So it is important that you keep records of what you do for your patient as well. Can I have the next slide, please? Some of the key skills to become a dentist, the main one I would say communication skills. It is important to have that communication skill with the patient and with your team. It's important to work as part of the team. And if you're someone who likes to look after people or taking care of people, that's a great skill. Leadership skills, thinking and reasoning skills, so to come up with a plan for the patient, to treat a patient. Creativity, I would say, is one of the main things, because we make teeth fillings, make them look like teeth, and and different with using specialist equipment. So people who've got skills, good hand skills, probably arts, modeling, all these would help towards your job as a dentist. And also it is important that you have thorough, you can pay attention to detail whenever you do things. So these are the skills you could look into yourself to say, oh yeah, not too bad, I could probably do this, So can I have the next slide, please? This slide is just giving you an overview of the environment we work and the hours. So we wear scrubs, gloves, masks, and safety glasses. You could do usually the working hours can be flexible. It can be between usually 9 to 5, and you can pick and choose if you want to work weekends or evenings. It's entirely up to you. You could be self-employed or you could own your own place. So you can be in general practice, you could work in hospital setting or university setting, or you could pick and choose to work part-time in different bits as well, which keep the interest going as well. Can I have the next slide, please? So this is just giving you an overview of different fields in dentistry. So once you come into dentistry, you will have a better idea about what different fields are about, and this will be an option for post graduation. So once you've done your dentistry, then you specialize in different fields, and these are the different fields for you to look into after your dentistry course. So now I'll hand over to Shalini to talk about the ORE.
Right, thanks, Rose. So my bit today is covering actually an area that originally we hadn't actually thought of, because we wanted to sort of target school-going children and those who are thinking of actually taking up dentistry as a career. But because we had some questions put through to us from Prakash about the what about parents who perhaps have sent their children overseas? They've had their people with overseas dental qualifications. So how would they then come in to work in the UK? So hence, I'm just going to cover this relatively briefly, but again, happy to take further questions, obviously, during the Q&A session and via Prakash if need be. So there are a number of ways to actually gain registration if your BDS degree is actually not from the UK or from previously recognized sort of EU countries or EEA. I would say to you, this information that is presented today, obviously be guided by this, but I would advise everybody to just keep sort of checking the General Dental Council, GDC, just Google GDC, and you'll find their website where some of this information is changing as we go along. As you know, with Brexit, some of the rules have changed as well. In terms of the Home Office as well, again, it's worth just checking to find out the latest information, because I think currently, as I kind of found, just found out recently, I don't think the dentists or the dental profession is actually classified as under the Home Office as a sort of a high priority for people coming in. Again, this could change according to the need in the country. So just keep a lookout on what the latest information is. And also, as far as I know, if you have graduated from an EU university or EEA, from January 2021, if I'm not wrong, you may have 2 years where you actually may still be able to get that sort of near automatic registration, but they do look at your cases case by case. Whereas for me and myself and Rose, so I came from Malaysia, Rose, as you know, from India. Our degrees were not automatically going to be looked at that way. So what we had to do and along with a lot of other graduates, I know friends from Australia, even from the US, if you do come in, you will have to probably end up sitting the IELTS and as well as as well as doing the ORE exam, which is the Overseas Registration Examination. So ORE is one route. This is an exam which I'll tell you a little bit more about in the next slide, but there's also another exam called the LDS. I didn't sit the LDS, but these are sort of similar-ish type of format exams, whereby if we go to the next slide, please. What you will definitely have is you'll have a theory component, and then you'll have a clinical component. Essentially, I think it's not the easiest exam. I think both Rose and I probably, it was a challenging time for us, wasn't it? Right, to get through it. And it definitely makes a difference if you've had at least a number of years in practice. I think practicing dentistry, having that direct patient treatment is quite important to actually make yourself feel more secure going into this exam. And of course, being in practice and not letting go of the theory as well of, I mean, if you look here, we're talking about applied dental sciences, a lot of basic sciences goes in as well. And everything that you learned in dental school will be asked here. And essentially they want to ensure that you are safe to practice in the UK. So it's fair enough. I think it is a tough, but at the same time, it is a fair examination. So again, if you go back to the GDC website, they do give you sample exams. They do give you sample questions. I think they do report even on the results of the exams. They're actually, I feel like they were quite transparent about everything. So you kind of know what to expect going in. So as mentioned, the part 1, I think you'll have 4 attempts to sit that. Expensive examination, so hopefully you'll pass in one go. That's just a computer exam. You go into computer room and it's I think a single best answer type exam. And then once you've passed your part 1, then you book in to sit your part 2. So part 2 is the more challenging one, personally I found, because there are different aspects of it. So what helped me was I looked at the different aspects of the exam, and I actually enrolled on some preparation courses. And what I targeted was I looked at where the exam would be held, and then I looked to that institute, for instance, to actually see if they had preparation or practice sessions that I could book in on, and that definitely helped me. So for instance, the OSCE exams is usually run by the Royal College. So Royal College of England, they usually, if you go to RCS England website and you Google sort of ORE preparation courses, they might have some there for you. So because you're sitting the OSCE exams there, I just found it useful that you already familiarize yourself with the place, and you're actually taught by people who are actually running, some of them running the exams, with experience having run the exam previously. And that I found helpful. The mannequin exercise, so you'll be expected to perform certain exercises on mannequin. They're very, very strict. Everything has to be super precise. So going back again to your skills in dentistry as well, you have to really have attention to detail. Things are measured to the millimeter, So these are the things, again, they're looking for in how you actually, because you're going to cut into people's teeth, right, at the end of the day. So you want to be accurate about it, and that's how they measure this. Mannequin exams, I just quickly mentioned, are the Eastman Dental Institute. And again, there are prep courses there. So, and then I think another component of medical emergencies is quite important to the whole profession in general. We are usually, in the best position really to provide any sort of management of medical emergency situations, which can surprisingly actually occur on the dental chair as well. So fair enough, this is quite an important component of the exam as well. So that was just a quick brief of that. I'll go to the next slide. So if you have decided that you're going to do dentistry, and I think Rose has mentioned all the different fields that you can go into as well. I think this applies to everyone in general as well. You can certainly take up further postgraduate studies, so there are going to be different types of courses. They're going to be the clinical based ones, and they're going to be the research based ones. Some of you who do dentistry might decide, you know what, I love treating patients. This is where my passion is. And I would like to specialize or learn more about a particular field of dentistry. For Rose and myself, as you know, it's endodontics, it's root canal treatment. And the other speakers, as you know, Nafisa is going into oral surgery. So she's doing all the wisdom tooth removals, difficult extractions. We're happy to refer to her. And then we have Nargis as well, who's hopefully en route to specializing in periodontology as well. So that's all to do with the gums and the structures that hold on to the teeth, and gum health is so important as well. As we know, there's a link to even general health. And again, in general, oral health is linked to our general health. It's not just, in mouth. So basically I think there's so many options for you to go into. You can do part-time MSc courses. We provide this at UCLan. You can do full-time specialist training. So if you decide you want to do full-time specialist training, these are usually the MClinDent courses, so Masters in Clinical Dentistry. Usually 3 years full-time in order for you to sit the exit exam. So basically, I think in dentistry, if you're going to join, just be absolutely sort of aware that, and just accepting that you're going to sit a lot of exams. Yeah, loads of exams, to the point that it's not like I never get nervous sitting an exam, but I think we're sort of used to it a little bit in a way, because we've had to sit so many throughout. So you're just constantly going to be assessed. Yeah. So I think to come to terms with that and make peace with that as well, and to be sort of, psych yourself out to be confident, in what you're doing as well. So anyhow, full-time 3 years, that will hopefully, once you pass the exams, that will get you onto a specialist list. But of course, if your BDS degree is not recognized, as we mentioned before, you need to sit the ORE as well. So I did it the other way around. So I did my specialist training registration, and then I did my ORE exam. So then only could I qualify to work in this country as well as get onto the specialist list. Hopefully you guys will do it the more smooth and straightforward way, which is get your BDS degree, get your specialist training if that's what you want. Do you really need to be a specialist? To be honest with you, I know loads of amazing general dentists who are doing really good work, taking good care of their patients, doing holistic dentistry, and they're making, a good living doing it. And, this, I don't think you need to be a specialist as such, but if that's your passion, obviously, go for it. Now there's also a different category of dentists, which is dentists with special interests. So those who are taking on sort of part-time courses, MSc courses, and then they're able to not only provide good general dental care for their patients, they've also got a little, a more focus on some of those specialist areas where they can provide more complex treatment. So that's another route which is open to everyone. Just quickly tell you how much it costs. So back in the day, I think my fees were 30K a year. If you are an international student, you will be paying about 50K a year for most of these courses. And of course, international means you have to be full-time. I think for part-time, if you're UK based, if you're going for specialized specialist or MSc type courses, postgraduate courses, you can pay up to 16K per year to up to 20K per year. So these are the still probably you want to save up, in order to, before you're thinking good and hard whether you would like to go into any postgraduate studies. And of course, there is the research part of it as well. So you could do a PhD as well. You could go into university and not touch a patient at all because you feel like research is where your heart is. You love going into the lab, for instance, or, just carrying out any sort of even clinical based research. If it's something that you like, you could fully just focus on research. So again, different routes that you could take. So I'll go to the next slide, please. So this is our end slide. Just to wrap things up, which is what all my colleagues have actually said to you. I think the most important thing is to say that you need to have a passion to go into dentistry, because once you're a dentist, although all our skills maybe can be good in other aspects of life, not really transferable as such if you decide you didn't want to do dentistry anymore. So be sure that this is what you're going to wake up in the morning and be happy to get out of bed and go and do, So it is a challenge, rewarding profession for sure. I think you can make a decent living from it. I wouldn't say the days where, dentists were thought to earn, like really easily earn a lot of money, great, but I don't think it's as easy nowadays. And also the medical legal challenges as well that we face on a daily basis. I think that's something that's always on our minds, and again, communication with the patient is so important in how, in everything that we do. So, and typical things for dentists, we always tend to have bad backs. Backache, not the best posture. I think my eyes were much better before I started doing dentistry, but again, part of the profession, right? And there are things you can do to improve things. Don't hunch over your patient. I say that, but I do that still quite a lot sometimes. But there are things that you know, I think you know, if you're passionate about patient care, for instance, if you love even aesthetics, you know, changing someone's smile, you know, changing someone's smile can be such a big make such a big difference in their lives. You know, you can improve someone's confidence, you can make them, you know, much happier people to face the world, kind of thing. So yeah, I think it's a very rewarding profession. As Nargis and Nafisa have pointed out as well, please start your preparation early. Think about what you are going to actually include into your application. You know, be good friends with your own dentist to see if, you know, you can get in just to do some observation. Speak to your career guidance staff at your school. And I think also think about it as, you know, if you don't get it the first time, this is really the career for you. So you've applied the first time and you haven't gotten it. Do you wait another year, apply again? There are different routes as well. At UCLan, we have students currently who were dental therapists before, and then who are currently doing further studies to actually get their BDS degree. And then again, the dental family is quite wide. You have clinical dental technicians, you have dental, obviously our dental nurses are critical, you know, essential to our daily provision of services. Dental hygiene, dental therapists, they are, you know, part of the whole profession, and we all work as a team. So keep an open mind to how you might actually get to that goal of being a dentist. Yeah, and hopefully that wraps things up for our talk, and we can go to the Q&A part. Prakash?
Yes, thank you. And anyone has any questions, please feel free to ask now.
What was the hardest part about becoming a dentist? You're muted.
Nargis, would you like to take that?
It depends where you're coming from, I think. I would probably say, for me, I think personally, it was getting in, because I don't necessarily come from the type of background that a lot of my peers came from. So there were no dentists in the family. It was my generation that were the first ones to go to university. Where I grew up, very, very low socioeconomic background. So my college actually told me that I wouldn't get in because I was a woman, and because I was an Asian woman, and people who go do dentistry are probably richer than me and white male. And I was a bit taken aback by that. And they were like, yeah, they'll be smarter than you, they'll be richer than you, they'll be whiter than you. And I was just like, oh, okay. And to come from, that was the careers advice that I got from my college. And a couple of my teachers, though, were like, no, you can get in, you can do it. So, you know, just work hard and you'll make it. And actually, I was the only person in my year at college that actually got any offers, even for an interview. So, and then I made it, and I put that down to a lot of hard work, a lot of faith from my teachers, and a lot of support from them. And I couldn't have done it without people believing in me. But I think Nafisa had a similar thing where she was told the same thing, like that she wasn't going to get in either.
Yeah, that's true. And I agree completely with Nargis. I'd say the getting in part was the hardest. I was told that the predicted grades weren't enough and I won't get in as well. And I had to take a year out because I only missed my chemistry mark by 3 marks. So I resat, and I applied again because that's something that I really wanted to do. I could have gone the other way where I could have done an undergraduate degree and then the postgrad. But again, thinking about from the socioeconomic approach, that I wouldn't have been able to afford it, and I'm so glad I did actually just take the year out, and then obviously I got to where I wanted to be. But yeah, don't let other people put you off. You know your capabilities, so I think that's the main thing. If you are really passionate about it, I think that's what you should just basically go for and try again. Just don't give up.
And hopefully these career advice staff members have retired. because I'm sure the ones who are practicing now, we're giving advice to all our young children. I think being inclusive and more diverse is definitely more. And again, who's coming into to actually a lot of females?
Yeah, I was surprised when I got to university, and it was 60% female, and of that 60%, more than half the year were Asian women. And it was actually one of my professors who told me, and he does like student assessments and stuff. He has a student assessment system that is used across nearly every dental school in the country. And he said, even though they're not allowed to rank students, the software actually ranks students. And he goes, consistently, doesn't matter which university you go to, Asian women will always rank high. There will always be an Asian woman ranked highest in any school. And he goes, it's just one of those things. He goes, they just do it. But yeah, and actually I was very lucky because again, with my background and everything, the person who actually encouraged me to even consider dentistry as a career was my dentist, to the extent that he was so passionate about, or he believed in me so much that I could do it. He put notes on my actual patient notes to be like, right, if she calls up and she wants work experience, someone needs to get in touch with me and we'll give it to her. And he actually gave me more, because I didn't get any through my high school. I got a week through my college and the minimum was 2 weeks. So then my own dentist, when I rang him up, was like, don't even worry about it. You can have as long as you want. And he gave me 2 weeks in the summer. He worked around me. He was absolutely amazing. And I now work with his wife at UCLan. So it's a very, very small world in the dental field. I would say getting in, and then actually I would agree with Nafisa, probably financially keeping yourself afloat at uni. So just being very kind of careful with how you spend. But once you're in, and you continue to work hard, it's actually really rewarding. I love what I do. We all love what we do. And there are so many pathways afterwards as well.
Thank you. Any other questions? Wow. No other questions? What is happening? Do I have to call names?
I think we covered the presentation very well. That might have answered everything.
I would give some advice to you guys. Just looking
I have written down at least 10 questions. Yeah. And
I would say, yeah.
But I do not want to read out. I hope somebody will ask the questions. So, yeah.
I was going to say, I'll give them a little bit of advice before going ahead, because I know we talked about work experience in dentistry. My advice to you guys, especially when you're so young, I personally think careers guidance in this country is terrible. I mean, I have friends who've studied in other countries and gone, you guys don't have a supportive system. You can't choose what you're going to do at 16 or 15 even. So my advice to you guys is get experience in different fields as well. So, you know, go out there and figure out what you want to do, because it is a profession that you kind of, if you don't like it, you are kind of stuck with it, or you're starting completely again, which is a hard thing to do when you're a bit older. So I'd say, you know, whilst you're in high school, there's nothing stopping you in kind of like a summer, just going, okay, I'll do a week at a law firm, or I'll do a week, you know, helping out in someone's business, get a retail job. It teaches you so much about customer facing stuff that is transferable to anything that is a profession where you do have to talk to the public. So very good, and it helps you kind of actually with stress in terms of managing stressful situations, which is something that we tend to have to do on almost a daily basis, and adapting. So you can get very, very good skills from other things as well. I know at Birmingham, one of the requirements of getting in, or one of the things that they did ask you, was not just about your work experience, but about jobs that you've had. And if you had a retail job and you managed to be at that retail job for anything longer than a month, they were just kind of like, yeah, okay, so they know how to deal with pressure because they've worked in public facing occupations, and they saw that as good. They saw that as you being quite independent and being quite grown up. So that I think always helps.
I'll just add on to that as well. Absolutely agree with what Nargis has said. You know, some universities will put up sort of tests for you as well. So you'll have I think we had a theory test, and then, then whoever passed the theory test would come on to sort of further sort of, we did stations. So you'd go to separate stations, and then you'd have a different scenario. And then sometimes you were asked to act something out. So if you already are very comfortable communicating, I think the best dentists in the world really are the best communicators. That's at the end of the day. You can have the most amazing skills, but if you can't actually speak to your patient in a way that they actually understand what you've done for them and the benefits of what you've done for them, it can still end, in not so well. So so some of these stations where we test you, besides the manual dexterity type skills, we also ask you to maybe read a scenario and then communicate certain news or deal with a certain situation. It will be everyday situations, but it will show us how well, that sort of communication skills are, and how well you can handle a sort of a potentially stressful situation, and potentially maybe an anxious or upset person, and you're able to manage that well. You should do very well in dentistry if you're able to do that.
And also in dentistry, you do have patients who are quite anxious to come and see you. And many of the time they'll tell you on your face, I don't like you, I hate you, but not, not in the,
not you, but maybe
not
the
profession. But we do get used to it. And eventually, but after you treat them and they finish off the treatment, they're quite happy that you, and they come back to see you, they won't see anyone else. So that's sort of like give you the job satisfaction again. So that's again with communication and how you look after them.
Yes, Sneha, you want to ask a question? I will prompt everyone now. Get ready, everyone. Yeah. Oh, by the way, those who are texting, sending message to me, please feel free to ask. Or if you are so worried, I will ask on your behalf at the end. Okay.
I don't have a question.
No problem. Okay, no problem. Yeah, get your question. Amiel?
How many years do you have to learn to become a dentist?
So the number of years dentistry takes varies from university to university. So a lot of the postgraduate courses are 4 years, because usually they'll accept people who've done, the first year of dentistry is always biomedical sciences. So if you've already done a biomedical sciences degree, that's usually accredited in your first year. So it means that you don't have to do the first year, so the universities can sign you off for it. And then you do it as 4 years. However, most of the dental courses are 5 years, regardless if you're the 14 unis that are predominantly undergrad applications, it's 5 years. King's do a fast track course, which means you can do dentistry in 3 years. A friend of mine did it, but he was accepted onto that because he did medicine and he was doing it as a route to Max Fax. So he already had the first 2 years of anatomy and biomedical sciences accredited. And again, what you tend to find is if you go down a postgraduate route, there are more frequent examinations really early on compared to other years or other universities where you're not postgrad, but generally 5 years. I think Manchester actually do a foundation one, but it hasn't run for a couple of years, so I'm not sure if it's active, where if you haven't done a science A level, they actually let you do it in 6 years. So they spend the first year building on the A level sciences, and then you enroll as normal straight onto the BDS program.
How would you deal with rude patients?
Very diplomatically.
Yeah, I was going to say as professionally as possible.
Yeah. Yes. I mean, on this, I think it's good for everybody to know that all sort of professional courses, so if you're a dentist, if you are part of the dental team, if you're a doctor, you are held to a higher standard than everybody else. Yeah. So even if somebody is rude to you, it's almost as if you don't actually have a right to actually be rude back to them. And obviously that's counterproductive anyhow. You wouldn't do that even on a daily basis, but just know that the General Dental Council will expect you to, if you're a registrant, will expect you to act in a very professional manner at all times. And this can even, I mean, of course, in your place of practice, but you actually really have to be professional, even if you go out shopping, if you go out on an evening out or something with friends, you are held to a higher standard. Let's put it that way. So you really should be, because you don't want to bring disrepute to the profession. So you have to almost feel like you are a dentist, and you kind of act in an appropriate manner at all times in dealing with anyone. I know it feels a little bit unfair, but it just means that you can't say certain things. Perhaps sometimes you can't, obviously, you can't act inappropriately. It's better to say, and even in the age of social media, the General Dental Council have guidelines to tell us that we should, so even if someone's rude to you online and sends you a nasty message, you can't reply back in a nasty manner.
We have our own do's and don'ts.
Yeah.
So we'll have to stick to it, and probably trying to keep calm. Whatever comes to you. It is upsetting. It's not, it's not anything like we are humans too, but I think it's just sticking to the rules.
Yeah, and maybe in on a more maybe personal note, maybe find out why the patient was rude to you. Usually people are not just randomly rude, are they? Maybe that patient was particularly scared or anxious on that day. Maybe they were so nervous and it came across, the way they were talking to you, it came across rude, but actually they were just worried about the procedure you're doing for them. So think about that. And I'm sure you will go through this, you will learn this, because the whole professionalism, leadership, and everything does play a big part in your dental degree.
And many of the time, dealing with it with calm nature.
Yeah, keeping calm is also very important.
And it helps them to calm down as well. And then probably you can have a conversation, and then you can sort the issue straight away. So,
and that's very British, isn't it? Keep calm. Keep calm and carry on.
Thank you. Gautam, you want to ask a question?
Can you recommend like any decent universities, and like, is there like any specific country where like if you move to, then dentistry would be very proficient and profound?
Oh, is it like going to Bulgaria to do the study? Do you mean that, Gautam?
Yeah, is it like any place where it's very proficient dentistry?
I think dentistry, medicine, you're not gonna go wrong doing it in any.
But it depends on whether you want to come back and practice in UK. Yeah. So if so, I would rather do it in here.
When you say move, do you mean you actually want to move there permanently to work, or as in you're actually just studying dentistry and coming back here to practice?
Well, both. Like,
also do it in the UK, just because other than America and Canada, it pretty much translates to any other country. Whereas for if you want to go to the States, if you want to settle in the States, I would say maybe go and do your dental degree over there, because they do teach it differently, and it is harder being a UK graduate going over there. You have to go through a few more hurdles over there. However, it's the same when they come from America to here, they still have to jump through hoops to get onto our GDC register. In terms of EU, doing it in EU countries, it used to be a little bit easier in the past, because EU, if you did your BDS in an EU country, you could apply to the GDC pretty much through a normal route. That is going to change after Brexit, and that is worth bearing in mind. If you're not from a British territory, places like Grenada or the Falkland Islands, then again, it's harder to get on the GDC register. So if you want to do it abroad and then come back, I would say you may actually be better off going down the postgrad route, or doing a gap year and waiting and applying again, because they are making it harder and harder for international dentists with international qualifications actually getting on the GDC register. I think you spend more time trying to get on the register when you get back than you would have done if you just hung out and waited a year and applied again, or actually done it through a postgrad route. I feel like Rose will agree with me on that.
Yeah, I think we didn't have a choice. So we're only sitting here doing this because and talking to you about that route because we didn't have a choice to do it. Like if we had a choice and we knew our lives would be in the UK, it would be so much smoother to just do a UK degree.
Yeah, I think yours and Nargis's and Nafisa's would have been quite straightforward compared to ours.
Yeah, it's tough getting in for sure. I think Nargis and Nafisa were one of the sort of, the few who actually got into such a competitive program. but that is a better and easier way to go in, more predictable.
Yeah, about becoming a dentist in the UK, the most difficult part I faced was doing the IQE exam, the licensing exam to come into this country. So I think that was, I think probably it's best that you do it here rather than going around.
And if it means waiting a year, if it means alternative routes, that's our opinion anyway. And as you can see, Nafisa and Nargis probably.
I was wondering if dentists get more money than medical doctors.
It depends on where you work and how hard you work. So, there's no hard and fast rules, but, it is a well-paid profession, and, you can pick and choose what you want to do. That's the flexibility you have, and you can be your own boss. And so
what was the motivation for you to become a dentist? Did you have a role model? Is that role model pushed you into dentistry, or what is so good about the profession?
Shall we get Nafisa to answer this?
So like Nargis, I didn't have anyone in the family who, to be fair, none of my brothers and sisters went to university, so I was the first one. So I think the main role model for me was my own dentist. He was lovely. Like every time I went in, he was so helpful, and I just loved the manual dexterity of it. It was either between medicine and dentistry for me, and I'm so glad I chose dentistry because, like Bro said, you have the flexibility. You are kind of like your own boss, and also you can actually work the hours that you want to. As well as it is rewarding to deal with patients who are anxious, but then in the end love you. It's just amazing. Yeah, you do get the odd ones where they don't, no matter how much you do, they still won't like you, but you kind of just roll with the punches there. So yeah, I think that's the main thing, like being surrounded by, going through the experience as well as being surrounded by people who are actually passionate about their job helps a lot as well.
Yeah, so I worked alongside hospital doctors, so I did on-calls, quite long on-calls as well. It really depends. I know a lot of my friends who do, or who are medics in hospital, they earn a lot more than me. But a lot of the times I would say don't make it come down to money, because contracts change all the time in the UK. So then when I was starting out, an initial salary that you would get after graduating was something like 60k. However, now the average salary is about 33. So it's dropped dramatically. So don't go on the money, it will change. It is equally rewarding. There's different challenges. I was encouraged by my consultants to pursue max facts, but I found I couldn't do the things that I found harder were when you deal with patients in terms of giving them bad news. The worst news I can give to a patient is probably that they're going to lose a tooth as a dentist, which, it's a tooth. Whereas it's much harder, and I've had to then have conversations with people's relatives that, you have cancer and we're not going to be able to do anything about it, or actually your relative passed away and you need to come in, or someone's been shifted to ICU. Those are far more difficult conversations to have. I applaud anyone who is able to go and do that and not be broken at the end of it, because I think for me, I'm usually a really tough person. My family rarely ever see me cry, but I would be that person that just feels so terrible that I've been the person who's had to say that to someone. I think there's different challenges in terms of timing as well. You can still be a dentist. Shalini, Rose, myself, and I know Nafisa, we work really long hours at times. I mean, there are times where Shalini and I are still working at like 1 o'clock at night, and we'll message each other because we know there's no one else awake at that time. But then my sister works as a doctor, and she's a locum GP, and she'll go in, she works 2-3 days a week. She earns easily 3 times my salary, and only does 9 to 5, 3 days a week. So it's very variable. Yeah, so if you want to, once you've done your dental degree, once you graduate, you have the option of doing foundation training. It's called DF1, Dental Foundation Year 1. And if you ever want to work for the NHS, you have to have done that year. So it's compulsory, a bit like F1, F2. F1, F2 aren't compulsory, But if you want to continue and never work in hospitals, then you have to do them. And it's the same with the DF 1 year. And then I went and did dental core training, which is further training in secondary care, such as hospitals, community, or like trauma facilities and stuff. And that adds on to, if you then want to be a specialist, you have to have done years in hospital before you can apply for a specialist post, if you don't want to go the postgrad studies route.
Okay. Thank you very much. Let me request Amiel to do the final thank you speech.
I'd like to say a special thanks to all the doctors who have found, all the dentists who have found time to come along and inspire us today. Thank you everyone for coming today's webinar. We're very pleased that you have come and we hope to see you all again.
Thank you everyone. Thank you for coming around.